A common question and concern for my fertility patients is skincare routine while you're trying to conceive. People often know that you should probably change your skincare routine once you're pregnant, but when you're trying to conceive, what about then? And when should you change? And the number one product that people ask me about is retinol. Retinol is having a moment. Dermatologists love it. You can use it for anything from anti-aging to acne. It's an incredible product, but typically it's recommended that you stop using it once you're pregnant. And so what about when you're trying to conceive? That is what we're going to talk about in today's video. I'm Dr. Lora Shahine. I'm a fertility doctor practicing in Seattle for almost 20 years and answering patients' questions every single day. Today, we're going to be talking about retinol and fertility and in pregnancy. Should you stop this medication before you conceive, when you conceive? We are going to go over a lot of information about this topic. We're going to go over 4 main topics. Number 1, we're going to talk about what retinol is and what it does. Number 2, we're going to talk about the concern about retinol. Where did this concern come from? Why can't you use it in pregnancy? Number 3, we're going to talk about the data. We're going to go over the research and what it really says. And finally, number 4, I'm going to tell you what I tell my own patients when they ask me this question. So topic number 1, what is retinol? Retinol is a family of chemicals called retinoids. These are derivatives of vitamin A that can be used in lots of different ways. You can have oral vitamin A derivatives like Accutane that help with acne, and you can have topical retinol creams that you can use on your skin to help with aging and fight acne in that way as well. These products can be over the counter or they can be prescription strength that you can get from your dermatologist. All of these products, when you put them on your skin, start to work immediately, and they act in a couple of different ways. The anti-aging effect or the minimizing pores, fine lines, that really comes from the stimulation of the skin cells to make more collagen. Retinols also decrease the oil gland production, so that's how they help with acne when you use it in a topical way. So incredible product, helps improve skin elasticity, texture, helps with discoloration. What does retinol not do? It's really an amazing product. But why do people worry about it in pregnancy? So topic number 2, what is the worry about using retinol in pregnancy or maybe while you're trying to conceive? Well, it comes from the fact that retinols are a derivative of vitamin A. And we know that too much vitamin A can be associated with birth defects if it's taken in early pregnancy. There's a landmark study out of the New England Journal of Medicine showing that really high levels of vitamin A supplementation, like over 10,000 international units a day within the first 60 days of pregnancy, was associated with birth defects like cleft lip and cleft palate. So with this warning and this understanding of high blood levels of vitamin A causing birth defects, you worry and you question, well, retinol, even though it's topical, it is a vitamin A derivative. And we know that we're absorbing chemicals, through our skin. And so the question is, well, is it okay to use topical retinol while you're trying to conceive or while you're pregnant? Or should we worry about that too? If you want to learn more about vitamin A and pregnancy and vitamin A and prenatal vitamins, I have a whole video here all about vitamin A, because vitamin A isn't all bad. You do need vitamin A to have a healthy pregnancy and successful fertility treatment. Vitamin A is the Goldilocks supplement. You can't have too little. Vitamin A deficiency is actually associated with birth defects and fertility issues. And you don't want to have too much because vitamin A toxicity is associated with birth defects. So you want it just right. So we know where the worry comes from. But now topic number 3, what does the data say? There's a really great question and answer all about topical retinols from the National Institutes of Health under the question that's sort of asking, what about using tretinoin, which is a topical retinol? Will it cause birth defects? The NIH says, hey, listen, there aren't really studies that show that using topical retinol has been associated with birth defects, but we can't say for sure that it doesn't. So it's better to be safe than sorry and not use it while you're trying to conceive. Okay, so what do the dermatologists say? These are the skin experts. There's a great review article from the Journal of the American Academy of Dermatology trying to answer this question. And they made 3 main points. Number 1, animal studies do not show that topical retinol use was associated with birth defects. Number 2, studies looking at blood levels of vitamin A derivatives after you're using a lot of topical retinol cream. The blood levels that are in your system are not as high as they are with oral ingestion of vitamin A derivatives. So we know from that New England Journal article and some other articles that the blood levels that come from really high high ingestion of vitamin A derivatives can be associated with birth defects. So we know what those blood levels are. And if you just look at blood levels after applying it to your skin, they're not even close to being as high. So the biologic plausibility that using topical retinol creams probably wouldn't cause birth defects. The third point from this really good review article is there is one well-designed study that really tried to answer this question. It's a population-based study actually out of the state of Washington over 20 years, and it's computer records of pharmacies and prescription filled in a certain group of patients that were in the group health system that were also followed throughout pregnancy and birth and kept track of birth defects or not. The authors were able to identify 212 women who filled and used topical retinol in their first trimester of pregnancy. And they also had birth data and birth defect information on this 212 women. And then they compiled a comparison group of women who delivered at the exact same time, about 400 women that were similar in age and when they delivered, but they did not use topical retinol. And they compared birth outcomes and birth defects in these two comparison groups, and they did not see a difference in birth defects. So of the group that used tretinoin or the topical retinol, the 212 women, 4 babies had birth defects. And in the group of women that did not use the topical retinol, the 400 women, 11 women had babies with birth defects. So for the patients who were exposed to the tretinoin, there was a 1.9% risk of birth defects. And for the patients who were not exposed to tretinoin, they had a 2.6% chance of birth defects. And remember, the overall risk of any birth defect in any pregnancy, no matter how it conceived, is about 3 to 5%. So this is actually lower than the general birth defects risk. And the authors conclude that this well-documented study provides substantial reassurance that topical tretinoin rarely, if ever, causes congenital disorders. Obviously, this does not rule out the possibility that topical tretinoin can rarely cause a disorder of interest under very special circumstances. It is, however, the only study of its kind because these are very difficult studies to do, and the required resources are available only under certain circumstances. So it's hard to do studies like this, and they're saying this is a well-designed study. We looked at the data, and it does not seem that using topical tretinoin in pregnant humans is associated with increased risk of birth defects. Okay, so now we know what the NIH says. We know what dermatologist says. What about OBGYNs? What does the American College of OBGYNs say? So they have questions and answers on their website as well, and they basically say it's probably not going to cause birth defects, but it is recommended to stop using in pregnancy. Better to be safe than sorry. So the fourth part of the video, what do I tell my patients? Honestly, I'm pretty reassured after reading the data in the animal studies and the blood level studies, and then that good population-based study in humans, that topical retinol treatment does not cause birth defects. However, just like every other doctor that you'll talk to, it's better to be safe than sorry. So I say when you have a positive pregnancy test, stop using retinol. There are some safe alternatives to retinol, and I think it's better to be safe than sorry. And as far as using it while you're trying to conceive and through fertility, I have no data to suggest that retinol is associated with impact on egg quality or sperm quality or fertility treatment outcomes. So it's probably safe to continue using while you're trying to conceive. And again, once you're pregnant, then I would stop at that point just to be overly cautious. I hope you learned something in this video today. I hope you were reassured and learned a little bit about how amazing retinol is, but what we should do while we're trying to conceive in an early pregnancy. Make sure you like this video if you learned something. Comment with questions that you have. Make sure you subscribe to this channel so that you get my weekly video. And as always, stick around for more learning.